Good morning to everyone. Today we are going to discuss about history of pharmacy in India. So how the pharmacy profession was developed in India and what are the acts they have implemented in India to regularize the pharmacy profession in India and to regularize the drugs in India. At the same time, we will discuss about the scope of pharmacy. So in ancient India, we all know our traditional medicine is not an allopathic system. So mostly our source of medicines are from vegetables, animals, and minerals. Originally, we used to get all the extract and we used to utilize those as a medicine to treat the patients. They are prepared empirically by few experienced persons. All those medicines are prepared by experienced person. There is no specific, everyone cannot prepare those medicines and dispense. So for that experienced person will be, they will do all the extraction process and they will take the drugs and they will prepare the medicines. And at the same time, the secret of the medicine's knowledge, they will not disclose to anyone. They will keep those secrets only with the family members. For example, you can see still in our country, we can see some Vaidya Salais. There they used to use, maybe it was started by their grandfathers, then father they was continuing, then their sons they were continuing. Nowadays their grandsons are still continuing. So they will not disclose the secret to anyone. At the same time, there is no scientific quality assurance test or standardization of the drugs will not be for those drugs. Whatever they know based on their old generation people, they will follow and they will make the drugs and they will treat the patient. And later, how the Indian traditional drugs was changed to some other level means we can say in our history, so many people have occupied our country and they have ruled our country. So initially, the Muslim peoples they have entered in our country and they have established their Arabic or Unani Tibi system in our country. And later, the Western or the so-called allopathic system came into India with the British traders, who later became the rulers of our country. They came to do trade in our country and they have occupied, captured our country. So they have used their own medicine for their people in India. At the beginning stage, they have not given that allopathic system to our people. Only they used for those their people. Later in 19th century, only it became popular to all our people also. They are allowed to use our people. Initially, all the drugs were imported from Europe. Later, some drugs of the system began to be manufactured in this country. For that, the Bengal Chemical and the Bengal Chemical and Pharmaceutical Works was established in 1901 by Acharya P.C. Ray in Calcutta. And the small factory at Parel, Bombay was established by P.K. Gujar in 1903. In 1907, a Alembic Chemical Works at Baroda by Professor P.K. Gujar was established. But that time, mostly drugs were exported and in crude form and imported in finished form. So at the time of World War 1914 to 20, the import of drugs were cut off and it was resumed after the World War. But there is no restrictions in the drugs import. And the manufacturer, the abroad manufacturers, they took advantages for this, by this. And they dumped the inferior quality medicines and adulterated drugs in India. Markets were full of all sorts of useless and deleterious drugs were sold by unqualified men at the time. For example, poisoning due to quinine, putting of croton oil into eye instead of atropine sulfate, selling of chalk powder tablet in place of quinine tablet. So there were, by using all this, year by year, they have established some laws to regulate these kind of problems and to monitor the pharmacy profession. So first in 1878, the Opium Act was established, which deals with the cultivation of poppy and manufacture, transport, export, and import and sale of this opium. In 1889, Indian Merchandise Act was established. It related to the misbranding of goods in general. In 1894, Indian Tariff Act was established. It leads to the levy of customs duty on goods, including foods, drinks, drugs, chemicals, and medicines imported to India or exported therefrom. And 1898, Sea Customs Act was established. It is goods with false trade description were prevented from importing under this sense. And 1919, Poisonous Act was established, regulated the import, poisoning, and sales of poisoning. At the same time, the Indian Penal Code also included some international offences punishment also. So later in 1930, the government of India appointed a committee under the chairmanship of Dr. late R.N. Chopra to see into the problems of pharmacy in India and recommended the measures to be taken. This committee published its report in 1931. It was reported that there was no recognized specialized profession of pharmacy. A set of people known as compounders were filling the gap. So just after that publication of the report, Professor Mr. M.L. Scroof, that is Professor Mahadeva Lal Scroof, initiated pharmaceutical education at the university level in the Banaras Hindu University. In 1935, United Province Pharmaceutical Association was established, which later converted into Indian Pharmaceutical Association. And the Indian Journal of Pharmacy was established by Professor M.L. Scroof in 1939. All India Pharmaceutical Congress Association was established in 1940. The pharmaceutical conference held in this session at different place to publicize the pharmacy education. In 1937, Government of India brought import of drug bills. Later it was withdrawn. In 1940, government brought drugs bills to regulate the import, manufacture, sale, and distribution of drugs in British India. This bill was finally adopted as Drug Act of 1940. In 1941, the first Drugs Technical Advisory Board was established. And 1945, drugs rule under the Drugs Act of 1940 was established. In 1945, government brought the pharmacy bill to standardize the pharmacy education in India. Earlier times, we used to follow British pharmacopoeia. At that time, our traditional medicines was not included in any pharmacopoeia. So the Indian government has formed a committee to give the report about the pharmacopoeias. And in 1946, Indian pharmacopoeia list was published under the chairmanship of R.N. Chopra. It consists list of drugs used in India at that time, which were not included in British pharmacopoeia. In 1948, Pharmacy Act was published. 1948, Indian Pharmacopoeia Committee was constituted under the chairmanship of late Dr. B.N. Ghosh. And in 1949, Pharmacy Council of India was established under Pharmacy Act 1948. And 1954, Drugs and Magic Remedies was established. And 1955, first edition of Indian Pharmacopoeia was published. And 1985, Narcotic and Psychotropic Substance Act has been enacted to protect the society from the danger of addictive drugs. So these are the basic works has been taken by the government to make the pharmacy as a profession in India. And to regularize the pharmacy profession and to regularly control the medication, these are the acts they have established. Now we will look into the scope of pharmacy. pharmacists, there are wide scope in all over the world. So that we can categorize in three types. One is practice section, one is industry, the another one is other section. So in practice means you can see community pharmacy, hospital pharmacy, clinical pharmacy, retail pharmacy, like that. So many scopes are there. Not only in India, all over the world, you will get wide opportunity for this practice settings. And the next one is you can see about the industrial settings. In industry, you will know that there are so many departments are there: production department, quality assurance, research and development, quality control, packing, regulatory, and sales and marketing. So whatever the drugs are manufacturing in India, which has been marketed by pharmacy professional only. So in other sections, it comes clinical research, regulatory. There are so many other opportunities in academic, clinical research and regulatory. Academic also you can go for teaching. In teaching also different grades are there and research oriented. So like this, so many wide scope of scopes are there for the pharmacy students. So proudly you can say, you can feel proud to be a pharmacist. And we all know the father of pharmacy is Dr. Mahadev Lalskov. The PCA has decided to celebrate his birthday on 6th as National Pharmacy Education Day to recognize his contribution in establishing pharmacy. So, thank you.